Joining me today is Dr. Lucas MacMillan, naturopathic physician and medical director of the Delbrook Integrative Medical Center. Dr. MacMillan is back on the program, and today's topic is fueling peak performance, a holistic approach to health for runners and cyclists. Welcome back, Dr. MacMillan.
Yes, hello, Christine. It's good to be here.
Yes, no, I'm really excited to have you back, and I love the topic. When we think of performance, we want to always improve. And my first question is, why is overall health important for athletes?
Yes, so it's common for many of my athletic folks to completely focus on how fast they're running, how hard they're pushing, their output on the bike, some of the hard quantifiable metrics. So it would make sense just focusing on that if we want to improve those numbers, if we want to push those forward, we would train exactly those things. That is absolutely an effective way to go. You can get a really good amount of change, and that is absolutely one of the requirements to get good numbers to keep improving. But what I'd love to focus on today is everything else. There's all these other factors that change how likely we are to go to the gym, to change how satisfied we are with our time at the gym, that can change our perceived exertion when we're putting out the same amount of energy. So if we can address all of these background factors and start shining light on, let's pay attention to how well we're sleeping, let's pay attention to our digestion, let's see how our body actually feels in between what's working and what's not working. We can allow our body to have the most resources to draw from when it comes time to perform.
Right. I mean, when I think of performance, like myself, we prioritize performance, but we need to look at our overall health, as you said, the sleep and the nutrition, healthy eating, and when athletes just think, oh, I got to perform, and they don't think of that, what are the potential consequences?
Yes, well, if you aren't giving yourself the fuel sources you need, the rest that you need, and the other bits and pieces that allow your body to actually do the work you want it to do, you'll start to slowly fall behind. That's where this is tricky, is you might not actually feel it. You might be doing very well, not realizing you're running at 90% or you're cycling at 90% of what you could otherwise be doing. So again, that we're talking probably a 10, 20% difference in everything that's offsite if you're training regularly and if you feel good. I find people who don't feel good, there's usually a much higher percentage change that we can make because their body is sending overt signals. But I really want to highlight you can feel amazing. You can actually be performing pretty good, but still very much not be at your peak because these hidden factors are holding you back. And I'm trying to help those to come into the conscious awareness of some of my athletes.
Right. And a simple blood test could really tell, right?
For some things, yeah, it's a really good place to start. If your
Mm.
iron levels aren't sitting where we want them to be, if your blood sugars aren't where we want them to be, and we can get fancy with some of the assessments we do. So, for example, a fasting insulin test is something that will look at your blood sugars and where they are now, as well as how much insulin your body is using to hold the blood sugar steady. So, one way to look at that, if your blood sugars have been steady for the past 5 years, that's never a bad thing. We never want to see them increase. And on average, with years of life, we start to see blood sugars increase just due to wear and tear, decreased insulin sensitivity, et cetera. So we can measure that. We can get ahead of the curve before our blood sugars really start to climb, or in some cases, get out of control. We can see insulin levels rise. It's one of the earlier markers that can tell us things aren't quite working the way we want to, and maybe we should focus more on specific exercise routines or things like maybe some muscle building or directly supporting that insulin sensitivity system. So, I mean, most times I have a chance to talk about labs, I bring up blood sugars, thyroid, and iron. They really are just some heavy hitters that are absolutely worth having an assessment of and being sure that these things are working the way you want them to, especially if there's any signs that these aren't. But there are a couple of other things that I really like to dive in, and insulin sensitivity is a really fun one because we can directly dial it in. It's something that is actionable. We can help people improve it, and then we can see improvements over time because the lab measures improve. That should always translate into doing better at your sport or having more energy and more clarity. Like the body should very much improve if we're going in the right direction anyway, and it should be something we can feel. But having those other metrics really allows us to do so efficiently.
Mm. So a lab test is quite helpful, right? As you were saying. And I with there's so much research out there that, can tell us about how, what we should do or what we shouldn't do. Um, I mean, it's useful, but there's some disinformation as well. So how does one navigate through, taking care of their health better?
Yes. So I guess step one is the big picture approach. So if we take a step back and we look at all of our information sources, we have things that we can essentially stumble upon or discover ourselves. We have things that we can get from other people, so friends, colleagues, other people that are training with us. We have people who are specialized or trained in that field. So healthcare providers, training coaches, nutritionists, there's quite a few people that fall into each of these categories. And I guess the last one I'll add on, excuse me, is online sources, YouTube, Google, etc. So there really are so many places you can get this information now, and that's not a an issue that we've had previously. I personally love it. I personally think it's a very good thing to have all of these sources because if you look at any one of them, there is no single source that will give you good information all of the time. And I think that's a
Mm,
really, really important concept is it actually doesn't matter who we're talking to or where our sources are. Nothing is 100%. So what that means is in the end, the responsibility does fall down to the individual person. So I think to do our due diligence and to give ourselves the absolute best chance, there's two things that really need to happen. One, we need to have somewhat of an understanding of what's going on ourselves so we can help to differentiate between what is clearly garbage and what is likely to be true, or what really has a good possibility of being true. So once
mm,
we have a decent understanding of that, then we can start really dialing in and getting the most benefit from the external sources. All of the things like, well, if I Google information and find there's a new study on this topic, or here's some fad trend, whatever information sources we're using, some of that really will be good information. Some of that really will be helpful. And I can flat out guarantee some of it won't. Unfortunately, I feel confident saying some of the information we get from our health providers flat out isn't the ideal information either. It has a much better chance of being good and being appropriate. But I think it's also important that we take a moment to think about these things because many of our healthcare providers, many of our coaches are very good at some things and they might be slipping or outdated on others. I'm not immune to this. I think every human being, just given the breadth of knowledge that is out there, the breadth of research, nobody can keep up on all of this. So we're going to slip or be outdated once in a while. It's just the way it is. So to make that actionable, if we have a bit of an understanding and framework. So if, for example, I learn, okay, I want to build muscle, the absolute basics are I need to train those muscles, I need to fuel those muscles with enough basic protein, and I need to sleep enough. If you have that basic framework to start with, then when people bring up these other ideas, you can apply it to that framework. Like somebody told me that this protein versus that protein might actually be better that fits with this framework that we understand, it's much more likely to be true if we can at least understand how it works. If there's some random new superfood that came out of nowhere that you can't find information online that somebody's saying is really good for you and they're trying to sell to you, it's much less likely to be true because it doesn't fit with what we currently understand. And when you're really unsure, that's a great time to bring it to a healthcare provider who focuses in these areas. So
right.
I know it's a
Mm,
big answer, but it really is that big of a thing to understand. There's all of these sources, none of them are 100%. So having a basic understanding or even a little bit deeper of an understanding yourself will allow you to ask better questions, will allow you to
mm,
better see when your provider actually knows what they're talking about, whether they're your coach or healthcare provider or otherwise. And you can build a synergy between you and somebody who gets it. If they are good at what they do, and if they truly know what they're doing, they should very much be able to explain it to you start to finish. And I find that piece is too often missing. Is there's a lot of protocols, but not a lot of understanding as to how these fit together in between.
knowledge is power, right? The more knowledge you have, because the onus is on us to do the research and to ask the right questions, and also your age too. That you have to consider that you want to be at a peak performance. How do you feel that? But you have to look at your age. When you're thinking, oh, I am in my 40s, and maybe you can't run. as well or cycle as well because there's an age factor or genetics or and so doing your
Hmm.
research around that is important, right? To look at your age.
Yeah, I think healthy expectations is a good thing. And I
Mm,
mean, if we're to look at the Olympics, you'll see very specific age ranges for a reason. It does change depending on sport. So it is super interesting that if you have a very high athletic output, the tends to be lower. But at the same time, I want to be really careful with that one because we've chatted before about the difference between what is common and what is normal. And I find age is a really big category that commonly blurs those two lines into one. So, common things are things that a lot of people have. So, friends, family, maybe people around you will see them all the time. Uh, what is normal, what I call normal, if we go even further to say what is optimal, is very commonly, it's very often very far from what we call normal. So it is common and normal to have decreased performance as we age.
mm,
So if you're 30 years of age and aging above that, there will be a gradual decrease in performance. It's not super linear, but there is a decrease that happens over time. What is not normal is to have a significant increase in pain or a significant increase in discomforts. It is definitely common, and there's sometimes that it's unavoidable. So we can call that normal. But it's amazing to me how many people come into the clinics and say, well, I had this, and this hurts. I have problems sleeping. I have this, but it's normal because I'm X amount of age. And
mm,
interestingly, in the clinic, people will say that in their 40s and people will say that in their 80s. Like it's just across the
yes.
board. But in my experience, I truly have patients who are in their 60s and 70s who don't have many, if any, of these problems. So I think that everybody's different. Our capabilities are different. Our likelihood of feeling pain is different. And just because something hurts doesn't absolutely mean we can make that go away. To set realistic expectations, we have to be honest with ourselves that the likelihood does truly go up when we get older. But I, across the board, think we've accepted far too much. We've called far too much normal. And there's so much missed opportunity for people to feel better, for people to perform better, and frankly, just to have a better quality of life because they're free to do what they want without these things holding them back.
Right. And Dr. MacMillan, what are some supplements that could be beneficial for athletes?
Yeah, so this is a really hot topic, and I guess diving into these, I always have to add the disclaimer that all of these should be looked over by somebody who knows what they're doing, or there should be something. I'm not allowed to legally give medical advice, so I'm not going to sit here and say
Mhm.
everybody should do these things. I'm very comfortable with them. With rare exception, I've used all of these both personally and with patients, and it's extremely rare to have issues. But just there are some people out there who have true deep-seated kidney disease, liver disease, or like a true medical reason that we shouldn't just be playing with everything. So for that reason, I'm throwing on the disclaimer to kind of be aware and be careful. But so one of my personal favorites that I don't find is talked about as much is called rhodiola. The full name is rhodiola rosea. It is a herbal extract that is most commonly used to help people in times of stress. The reason I'm bringing it up here is it's something that I've commonly found helps my athletes to have a decreased perceived exertion. And there are direct studies on this, decreased perceived exertion for things like running and cycling. So, meaning if we change nothing else in somebody who's training very stably, if they're normally training at a level where their perceived exertion is a 7 out of 10, we can drop that to a 6 out of 10 or a 5 out of 10 simply by making a change like this. So, as per anything with research, this will work really well for some people. This will work mediocre for others, and this won't work at all for another group of people. There may even be some people where if they take this, they feel like they don't perform as well. So, as with any recommendation, as with any medication, as with any supplement, keep that in mind. But by far, and as per the research, there's more of a benefit. So, plugging this in and ideally monitoring your quantitative metrics, your performance, your times, your output, etc., you can really get a sense as to how does this feel and how is it quantitatively affecting my training.
Right. And I mean, can you share any testimonials, Dr. MacMillan?
Testimonials. I
Hmm.
hmm. I work with this quite often, so what's a really good case? I'm going to keep this a little bit broad because I don't want to have actual names on there, and there's a decent chance that some of my patients will listen to the podcast, so I
Yes.
don't want them to feel too centered out. So keeping this broad, so one of my female patients is a very regular cyclist. That's very much her sport. It's been that way for a very long time. She's very good at what she does. She very regularly competes. Amongst other things, we're regular doing either B12 shots, nutritional IVs, or both. So there's quite a few that we're throwing at that. But in her case, rhodiola was one of the things that very clearly pushed the dial forward. Um, when she started using this, she was feeling clearly less stressed through her day and started feeling that she was able to push more and actually compete better just with that one change. So, in some cases, and this isn't all the time, but in some cases, I have the clarity of just adding one thing at a time. So we can very clearly see how well it is helping. So thankfully, I find with some of my athletes that are really trying to dial it in, that really is the best approach to take. And in hers, it was a very clear difference that it is clearly moving her forward. The biggest difference, to be completely honest, was just like it just feels better. I feel like this is something my body really likes. And I feel like I'm less stressed. I feel like I'm less buzzing throughout the day and while I'm actually training. So that's valuable. If
Mm.
there's no other changes, I 100% would recommend something along that side.
Oh, that's wonderful. And, thank you for sharing, Dr. MacMillan. And I mean, you know, tell us about the services you provide. People are listening and they want to, contact you. Number one, what other services you provide and where can they go?
Yeah, so I'm at the Delbrook Integrative Medical Center in North Vancouver. The services provided are pretty varied. So, as a naturopathic physician, I was previously a registered nurse as well. I do prescribe medication. I do regular lab tests, many of which we do on site. So, I actually personally do the blood draw in many cases, and then we basically process it and have it taken to Life Labs for you. So, you can skip that step. Most often, we get the results the next morning. So, it's also incredibly
Mm.
fast. As I mentioned with another patient, I do nutrient injections and IVs. I find these are a fantastic way to quickly assess people's levels. Like if we give you a good shot of B12 and your body needs it, people feel different within a day, maybe two. So I often trust their response more than I trust a simple blood test for B12. We can also do that, but I want to know how the body's going to respond, not just what the lab levels say and how that compares to the average levels in the average person. I do pain related injections. So we can inject prolotherapy or PRP into joints, into ligaments, or into some of the places where they connect to bone. So most commonly for osteoarthritis or for injuries. I focus quite heavily on dietary changes, on lifestyle changes, on where supplements fit. I most commonly find supplements help to create change. Once you've created that change, it's most of those supplements aren't really necessary anymore. There's other often better ways to do it. But I love the clarity of changing one ingredient in a supplement to very clearly create a change and see if it's working or not. At the clinic, we have counseling now. We have registered massage therapists. I'm not the only naturopathic physician who works there. So we do also have a team approach, which I think is a really nice way to round out the offerings at a clinic. And we test all sorts of stuff. We test hormones. We test reactions and potential reactions to foods. We test genetics. And there's some super interesting information coming out as to how to use genetics to fuel
Mm.
performance or to fuel health. It's very much an evolving science, but it's super interesting, and we've
Yes.
had some kind of neat breakthroughs with all of these. So there are many, many, many options, and a big part of why I'm a naturopathic physician, if we find something, ideally through research, but I've trialed other things as well. If we find something that works and we can be reasonably certain it is safe and worth doing, we can do it. There's a lot of openness and variability to the approach that we take because people need different things. I love being in a position where we can safely and systematically trial those things.
Yes. No, wonderful. And is there anything else you'd like to add, Dr. MacMillan?
Mm-mm-mm. Let's see. Yeah, so rhodiola, I should have said this earlier. Common dosage is 200 milligrams. I often go above that or around that. But anytime we're dealing with herbs and herbal extracts, there should almost always be a standardized active ingredient. So rhodiola, the rosavins and salichrosides. So you'll see those names, salichroside and rosavins, and a percentage or an actual amount of the active ingredients that are within that. That's what tells us this product is actually standardized to the active ingredient, because I could technically remove those active ingredients and sell the leftovers because it is truly a rhodiola rosea root that's left over. I just wouldn't have on the ingredients list those active ingredients. So if you want to get the most out of herbal extracts, look for active ingredients and some kind of standardized measure saying that there are active ingredients and that the amount of that is actually listed. So I should have brought that up earlier, but it is a very important point. Let's be sure we're getting products that are actually standardized to something that matters rather than just getting bulk herb that may have the active ingredients removed.
Dr. MacMillan, thank you so much for being on the program, and I would love for you to come back. Great information.
Yeah, thank you so much. I'd love to come back as well. It's a good chat as always and a fun topic. So thanks for the opportunity to chat about it.